A medical assistant must label a blood specimen collected for cortisol at 8 a.m. Which additional action is essential for test accuracy? A. Store the specimen at room temperature. B. Add ice immediately. C. Shake the tube vigorously. D. Note the collection time on the requisition. Answer: D. Cortisol levels follow diurnal variation. Documenting time ensures the lab interprets results within the correct physiological range. A patient on antihypertensives becomes dizzy during orthostatic vitals. What should the MA do first? A. Continue the measurement. B. Assist the patient back to sitting. C. Notify the provider after completion. D. Offer water. Answer: B. Safety is priority. Dizziness indicates possible syncope, and the MA must immediately stabilize the patient. The MA must perform a wound culture swab. Which technique ensures the most accurate sample? A. Swab only dry areas. B. Clean the site before swabbing. C. Swab deep in the wound center. D. Touch the swab to the edge first. Answer: C. The wound center contains the highest microbial load, providing the most diagnostic sample. A patient with COPD has SpO2 of 88%. What is the appropriate MA action? A. Recheck using a different finger. B. Administer oxygen without order. C. Document and inform the provider. D. Ask the patient to breathe deeper. Answer: C. 88% is below acceptable COPD targets. The provider must be alerted for clinical evaluation. When preparing an intradermal injection for a TB test, which needle size is correct? A. 18 gauge 1 inch. B. 22 gauge 1 inch. C. 25 gauge 5/8 inch. D. 27 gauge ½ inch. Answer: D. Intradermal injections require small, thin needles to create a wheal and avoid deep penetration. A patient with a potassium level above 6.0 milliequivalent/L arrives for a follow-up. Which symptom should concern the MA? A. Thirst. B. Muscle twitching. C. Irregular heartbeat. D. Tingling fingers. Answer: C. Hyperkalemia can trigger fatal arrhythmias. Any cardiac-related symptom is a medical priority. While cleaning a contaminated exam table, which disinfectant strength is appropriate for blood spills? A. 110 bleach solution. B. 1:100 bleach solution. C. 70% alcohol. D. Soap and water. Answer: A. A 110 sodium hypochlorite solution meets OSHA's requirement for high-level bloodborne pathogen decontamination. A patient refuses a treatment due to religious beliefs. What should the MA document? A. MA opinion. B. Provider's frustration. C. Exact patient statement. D. Possible alternatives. Answer: C. Documentation must reflect objective, verbatim patient responses, not opinions or assumptions. An MA must ensure the correct medication before administration. The right drug check includes: A. Verifying expiration only. B. Viewing the label 3 times. C. Asking the provider to confirm. D. Checking drug color. Answer: B. Triple checking the label is a core component of medication safety protocols. A patient with diabetes shows cool, clammy skin and confusion. What should the MA give? A. Insulin. B. Protein snack. C. Fast-acting glucose. D. Water. Answer: C. These are signs of hypoglycemia requiring immediate glucose replacement. Which action violates chain of custody procedures? A. Locked transport containers. B. Leaving the sample unattended. C. Documenting each handoff. D. Patient's signature confirmation. Answer: B. Unattended specimens compromise legal validity and specimen integrity. When performing EKG lead placement, which situation requires immediate correction? A. Leads are warm. B. Electrodes applied to moist skin. C. Slight hair at placement site. D. Patient is anxious. Answer: B. Moisture interferes with conductivity and may distort tracing quality. Which is the correct response when a patient begins to seize in the waiting room? A. Hold the patient down. B. Insert a tongue depressor. C. Move objects away from the patient. D. Give water afterward. Answer: C. The priority is preventing injury. Restraining or inserting items is unsafe. When faxing PHI, which step protects confidentiality? A. Fax at busiest hours. B. Use pre-programmed speed dial. C. Confirm the recipient's number. D. Send without cover sheet. Answer: C. Verifying the receiving party prevents accidental disclosure of sensitive medical information. An MA must record a respiratory rate but believes the patient is intentionally altering breathing. What should they do? A. Ask the patient to breathe normally. B. Count while pretending to check pulse. C. Stop the recording. D. Ask the provider to repeat. Answer: B. Observing respirations discreetly yields the most accurate measurement. A hemolyzed serum sample may occur due to A. Underfilling tube. B. Using correct needle size. C. Allowing alcohol to dry. D. Rapid, forceful syringe draw. Answer: D. Excessive suction pressure ruptures red cells, altering test results. An MA reviews a medication order that appears unusually high. The correct action is A. Administer it carefully. B. Ask another MA. C. Verify with the provider. D. Refuse to give any medication. Answer: C. Clarification of questionable orders is required to ensure patient safety. During ear irrigation, the patient reports sharp, sudden pain. The MA should A. Continue slowly. B. Stop immediately. C. Increase pressure. D. Use cold water. Answer: B. Pain could indicate canal damage or perforation. Irrigation must stop. Which vaccine route uses the vastus lateralis in pediatric patients? A. Oral. B. Subcutaneous. C. Intramuscular. D. Intradermal. Answer: C. The vastus lateralis is the safest IM site for infants due to muscle development. A patient wants their lab results emailed. What must occur first? A. Provider approval. B. Verifying email spelling. C. Patient's written consent. D. Encryption turned off. Answer: C. HIPAA requires documented patient authorization before electronic release. A patient smokes heavily before a pulmonary test. The MA should A. Encourage deep breaths. B. Note the deviation on requisition. C. Cancel the test immediately. D. Offer water. Answer: B. Smoking affects lung capacity, Documentation ensures accurate interpretation. A critical lab value appears in the system. The MA should A. Print it for the patient. B. File it in the chart. C. Wait until provider is free. D. Call the provider immediately. Answer: D. Critical values require prompt provider notification for rapid intervention. Which action ensures accurate 24-hour urine collection? A. Save the first morning urine. B. Discard the first specimen. C. Keep container at room temp. D. Shake container after each addition. Answer: B. The timing begins after discarding the first urine, collecting all subsequent samples. When explaining a procedure, the MA should use A. Medical terminology. B. Long, detailed paragraphs. C. Clear, simple language. D. Written instructions only. Answer: C. Simplified communication enhances understanding and informed consent. A patient reports new severe chest pain in the clinic. The MA should A. Activate emergency response. B. Move them to exam room. C. Take medical history. D. Offer aspirin automatically. Answer: A. Sudden chest pain is a medical emergency requiring immediate action. A patient becomes verbally aggressive. What is the best MA response? A. Acknowledge feelings and maintain boundaries. B. Move closer to calm them. C. Match tone. D. Ignore them. Answer: A. De-escalation requires empathy without compromising safety. Which PPE is mandatory for assisting with wound debridement? A. Gloves only. B. Gloves and gown. C. Gloves, mask, and protective eyewear. D. Shoe covers. Answer: C. Debridement has splash risk. Full face protection is essential. A panic attack presents with chest tightness and hyperventilation. The MA should A. Provide a paper bag. B. Encourage slow breathing. C. Call EMS immediately. D. Place supine. Answer: B. Controlled breathing reduces hyperventilation and supports stabilization. Which error occurs if an MA copies information from another chart? A. Negligence. B. Battery. C. Abandonment. D. Fraud. Answer: D. Copying data constitutes falsification, compromising legal and clinical accuracy. A patient faints during venipuncture. What should the MA do first? A. Offer juice. B. Continue holding pressure. C. Call EMS. D. Remove the needle. Answer: D. Removing the needle prevents injury and allows safe positioning. The MA notes a blood pressure cuff that is too small. What outcome is likely? A. Falsely low reading. B. Falsely high reading. C. Unchanged reading. D. Irregular pulse. Answer: B. Small cuffs increase pressure artificially, inflating the BP reading. A patient with a latex allergy requires equipment setup. Which item is unsafe? A. Vinyl gloves. B. Blood pressure cuff. C. Elastic tourniquet. D. Synthetic stethoscope tubing. Answer: C. Many elastic tourniquets contain latex and must be replaced with latex-free options. A CLIA waived test still requires A. Performance by a provider only. B. Complex instrument calibration. C. Following manufacturer instructions. D. Specialized laboratory. Answer: C. Even waived tests demand strict adherence to instructions for accuracy. Which symptom indicates potential diabetic ketoacidosis? A. Weight gain. B. Fruity breath odor. C. Slow pulse. D. Hypertension. Answer: B. Ketone accumulation causes a distinct fruity odor and signals metabolic emergency. An MA documents a patient's subjective complaint as: A. Rash on arm. B. Temperature of 100.8 degrees Fahrenheit. C. Sharp abdominal pain stated by patient. D. Redness observed. Answer: C. Subjective data includes statements from the patient, not measurable findings. When performing capillary collection, which finger is preferred? A. Fourth finger. B. Index finger. C. Thumb. D. Fifth finger. Answer: A. The ring finger provides adequate tissue depth and low nerve density. The MA notes a prescription written illegibly. Next step: A. Guess the drug name. B. Ask pharmacist. C. Clarify with provider. D. Leave it unchanged. Answer: C. Illegible orders must be clarified to prevent medication errors. When using a peak flow meter, the patient must: A. Blow slowly. B. Seal lips tightly. C. Inhale into the device. D. Lie down. Answer: B. A tight seal ensures all exhaled air enters the meter for accurate measurement. A urinalysis reveals large leukocytes. What does this indicate? A. Dehydration. B. Infection. C. Contamination. D. Diabetes. Answer: B. Leukocytes commonly indicate urinary tract infection or inflammation. Which is the correct clean catch midstream technique? A. Collect first stream. B. Touch inside container. C. Clean perineal area. D. Hold container above waist. Answer: C. Proper cleansing reduces contamination and increases diagnostic accuracy. The MA must schedule a fasting blood draw. The correct instruction is: A. No food for 4 hours. B. Water only for 8 to 12 hours. C. Avoid carbohydrates. D. Skip medications. Answer: B. Standard fasting requires avoiding caloric intake but allows water. A patient's heart rate is irregular. Which method gives the most accurate reading? A. Count for 15 seconds. B. Use automated cuff. C. Count for 60 seconds manually. D. Estimate using respirations. Answer: C. Arrhythmias require full-minute manual counting for accuracy. A patient is at risk of syncope during venipuncture. Best preventive measure? A. Have them lie down. B. Offer water. C. Stand them up. D. Distract them. Answer: A. Lying down prevents falls and improves cerebral blood flow. Proper handling of a specimen requiring chilling includes: A. Freezing immediately. B. Transporting without coolant. C. Placing in ice slurry. D. Warming before transport. Answer: C. An ice slurry keeps specimens at required temperature without damaging cells. The MA must measure infant head circumference. Correct landmark? A. Bridge of nose. B. Eyebrows and occipital prominence. C. Top of skull. D. Ear to ear. Answer, B. This circumference includes the largest cranial diameter for consistent growth tracking. A patient signs an informed consent form but later appears confused. The MA should: A. Proceed. B. Ask family to sign. C. Notify provider immediately. D. Have patient sign again. Answer, C. Consent is invalid if the patient lacks understanding. Provider reassessment is required. Which is a HIPAA violation? A. Closing computer screens. B. Discussing PHI in public hallway. C. Using encrypted email. D. Locking file cabinets. Answer, B. Conversations involving PHI must occur privately. A patient's BP reads 160/98. What should the MA do next? A. Document and retake after several minutes. B. Change to smaller cuff. C. Ignore reading. D. Diagnose hypertension. Answer, A. Rechecking confirms accuracy and allows proper clinical follow-up. Which test requires chain of custody documentation? A. Lipid panel. B. Glucose tolerance. C. Employment drug screen. D. CBC. Answer, C. Legal testing must follow strict custody tracking to prevent tampering. A patient with vertigo reports falling frequently. The MA's priority is: A. Schedule physical exam. B. Provide fall prevention education. C. Offer water. D. Perform venipuncture quickly. Answer, B. Preventing injury is critical. Safety instruction reduces fall risk.